Hi, if you're watching this video, then I guess you are thinking about buying health insurance. But sometimes it's difficult to understand what the difference might be between receiving a treatment via the NHS or in a private facilities, how much will it cost, and whether it's worthwhile investing your hard-earned money into this product, especially if you're healthy and do not have any issues. Here is the thing. The most significant reason of buying health insurance is the difference in the waiting time to receive the treatment. Just try to think about it. There are over 65 million people living in the UK, and as the NHS is free for all, there are always thousands and thousands of people at any given time in need of getting a treatment done. This has a detrimental effect on both speed and, unfortunately, sometimes the quality of the service provided. The general rule, which, by the way, was set by the government, states that the patient should wait no more than 18 weeks for their elective treatment. However, it doesn't mean at all that you will receive the treatment within these 18 weeks, as if it's non-urgent surgery, you can wait for well over a year. For example, in April of this year, the NHS published quite an interesting statistics, which says that 4.7 million people are on a waiting list for their treatment, of which 387,500 have been waiting for the treatment for more than a year. Just think about these numbers. I'm sure if your loved ones will need a treatment or a surgery, you will want them to avoid any delay and find the best treatment available. So what are the alternatives? Well, there is only one alternative, and it's private hospitals, which allows you to skip this enormous NHS queue and get the required treatment done without any delays. Of course, you can pay for the whole consultations, treatments and surgeries out of your own pocket, but I won't lie, you need to have a very deep pockets to pay for it for yourself. I have worked in the insurance industry for almost 10 years, and I know full well that a typical knee replacement surgery, which by the way is quite a frequent procedure nowadays, as due to the lockdown, a lot of us start working from home and running during their lunch. From start to finish, in private hospital will cost around £25,000. Heart surgeries will cost around 25 to 30k depending on their complexity, but cancer treatments is at the very top of the price list, as the full treatment can cost well over 100k. So considering the price tag for the treatments in private hospitals, I guess your only question now is how much does the health insurance cost which will cover these treatments? Well, there are three big factors which affects the price. The first is your age. I guess this is a straightforward factor, as the older we are, the greater the likelihood of getting an illness, and hence the price is higher. The second factor is your address. It's fairly logical here too. End of the day, a private hospital is a business that needs a premises where they're working from and employees, i.e. doctors and nurses. And if this hospital is based far north of Scotland, then these costs will be way less than in central London, hence why your address is also affecting the price. And the third factor is how wide your policy is. I guess it's obvious here that the wider your package, the more expensive it will be. To have a general idea of what to expect, I will give you my own example. I have a policy which covers not only myself, but also my wife. I'm 34 by the way, and she's 27. Our policy covers all possible surgeries, regardless of their price, unlimited scans, unlimited consultations with private specialists, full diagnostics cover, as well as the alternative medicine and few other bits and bobs. So in other words, it's a full bells and whistles cover, which you, by the way, don't have to take. And this policy costs us £94 a month. So considering the cost of the treatments in private facilities, is £94 a month a lot? Well, on one hand, yes, but on the other, not really. Some people are buying a full Sky package with sports and movie channels that cost the same money. Others are buying the latest iPhones for 60 or 70 quid a month. It all depends on how are you looking on this expense. Personally, I just put it down in the mandatory payments, same as the council tax. I understand that I would be paying for years without using it, and I actually hope I will never need to use the policy, but I would rather have this safety net in case if something goes wrong. Do you need this policy? Well, the decision is yours because I've already made mine. The only word of advice is that if you decide to get one for yourself and your loved ones, then get in touch with a good broker like Albatross Healthcare, who will not only find you a suitable cover at the right price, but also help you in the event of a claim. Not many brokers and certainly faceless comparisons websites offer this. Thanks for watching and see you soon.